each one of us, whether it is the students or the faculties, the entire team is totally motivated and dedicated, and we just want to see the D-Day, as Rajat sir rightly pointed out. I would like to give a very, very warm welcome to all our esteemed faculty as well as all our students, because each and every one, including the admin team of MITS, each one of us have really worked our hearts out during this journey of last 7 to 8 months awesome results from our students. So I really do a very, very warm welcome to every one of you, and very warm welcome to Dhawan sir, Amit sir, and all the esteemed faculties, Salman sir, Sayantan sir, Rajat sir has already spoken about, Ankur sir is here, Kunal sir is here. So a very, very warm welcome to everyone. And I would like to request Kunal sir to take over and
Hello everyone, welcome from our side. And, faculties who are thank you for joining the students. I mean, now as we all know that it is the last 31 odd days left for the exam. So like this is a phase when all the questions which are popping up in the students' minds from during the days of preparation, they become very and students start to get into a self-doubt kind of a thing, and then there are so many anxiety and all those issues which comes up. So this is the time when final 30 days, this is the time when the revision starts. So it was just a thought that we would come and talk to our beloved students and let them know that what we feel regarding certain very common question being asked to all of us by different various students. So the most important question of all was that how to plan a day for revision, and I think Dr. Rajat sir has shared a very good thought of his on this thing, and I sincerely hope that it's gonna help the students. Now, the second thing that comes to the students' mind in this time, that what should they follow? I mean, whether they should be doing the notes or they should be solving the MCQs at a proper higher rate, or some questions I have received that whether the missed tolerant one should only be followed at this point of time. So for this particular question, I would like our Dr. Salman sir to please share his thought. Please. Sir, could you please unmute yourself, sir?
Okay, so I'm audible, sir?
Yes.
Yeah, very good afternoon to all the faculties and all the doctors in the house right now. So as you know, it's about a month to go for the exam, and as Dr. Rajat has referred to it as the doomsday or the D-Day, right? We are all prepared for that. But despite of, no matter how much we prepare for this exam or any exam, right, whatever we are going to face later on, we will always have some kind of a negativity, some kind of a fear inside us. And you all should understand one thing, that fear is something that drives us to be a better us, right? As they say, smooth seas do not make skillful sailors, right? So this is the thing. So you all have to accept one thing, that fear is gonna be there, right? And you're gonna prepare under this pressure as well as the fear. Now, you're not the first ones who are going to take this exam now, right? There have been many batches that have done this before. So know one thing, that if they could do it, you could also do it, right? So you have joined us, trusting us, you have joined the mist. So let's all be optimistic, right? Like that you can remember. Now, the question that the Dr. Kunal has referred to me, like what to follow in the last days. See, this is the last month of the exam. That means you're not studying something for the first time, right? So again, as Dr. Rajat has told us, do not go for something new in the last 30 days. All you have to do is just follow whatever you have already covered. This technically should be your at least second to third reading now, right? So follow the notes first. Number one priority is the notes, right? So, there are 300 questions altogether. But there is one thing that you all have to understand, that there would be at least 50 to 60 questions that would be like comparatively very hard, or sometimes may not be from our notes. So do not panic, right? So that means if you're solving 10 questions in the first block, let's say, so you might feel there would be one question that you cannot answer. Just leave it. It's okay, right? Choose whatever the best answer could be for that, and then move ahead, right? So like that, you have to have something in your mind that there would be questions that we will not know. Even the topper will not know all the questions, as you know, right? We are targeting ourselves to pass this exam. So number one priority is notes and revision, 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 as you all know, right? Next, many people say, sir, what about the missed all-in-one? Whatever you see in the missed all-in-one has already been covered in your notes. See, missed all-in-one is just a gist of that, right? But definitely you want to revise your notes, right? Your weak areas at this point of time. Now, let's say you're trying to finish up your revisions of all the 19 subjects in the next 20 days, for example, right? Some subjects are bigger, they require more attention, more time. The smaller subjects you can finish in a half a day or so, right? If you have already revised them well. Now, what you should do, at least if you haven't done it so far, is try to underline certain weak areas that you're forgetting, right? And how do you revise something? Always like close your eyes after you have once studied a page and try to reproduce what you just studied. If you're able to do so, then that means you know that topic. If not, just highlight it so that you know that this is my weaker point, I should revise it again. So because now there should be at least 2 revisions that you have to do, like a fast paced revisions. It's not going to be like understanding concepts and everything right now. What you can do is just quick paced readings. So first 20 days, maybe it's my advice to you, and you can take advice from all the other faculties also. But first 20 days, try to keep it right now for revision of every subject. Now, this exam, you have to be a jack of all. Don't try to become king of one. You have to study all subjects to pass this exam, right? So revise it up once. Notes are compulsory, right? And trust us, this is more than enough for passing your exam. Notes are more than enough. Now, many of you may get a question, sir, should we be solving MCQs? Sure, you can, right? You can refer to the questions that we have earlier given you in the mist, or you may follow some MCQ book. But remember one thing, that there might be mistakes in the MCQ books. So always refer to the answers from the notes what we have given you, right? This is very, very important. I'm sure by now, if you have solved questions, you have seen there might be some mistakes or some differences in the answers. But trust the faculties, choose their answers, whatever they have given you. Okay, so missed all-in-one anyway would be covered once you have covered the notes. Next, last 10 days, again, right, you will have your own program, or maybe some faculty will tell you right now. Okay, that last 10 days is again for the last recap of certain things that you may forget that you will have to do. So that means this 1 month also you should divide into 2 quick revisions, right? So notes is your number one priority right now. Please try to follow that. Missed all-in-one would be covered through that itself. And then MCQs at the end of the day, 15 to 20 MCQs, or maybe more, or try to keep like an hour for solving MCQs. That would kind of give you a good, feeling that you're able to solve them. So solve MCQs for sure at the end of the day. All right. So next thing is the sleep hours. Sleeping is very important. Like at this point of time, many of us just think that I'll study for more hours and then not sleep. That's not a good idea. You have to have at least 5 hours of sleep right now right? Because again, for memory consolidation, you need the sleep, as you know. Okay, so divide your day into proper, schedule, like what you're going to do. Have a plan, and if you run through the plan, you will definitely make it. So that's all from me, my friends. All the very best, and I'm sure you're going to come out with flying colors and good news. All right, thank you from my side.
Very much. Thank you very much. It would have been delighted seeing your face and seeing you and this. So, thank you very much for coming. There is one more question which comes up all the time to us, and that is, as we all know, that the pattern of the exam is changing. Way before 5 years, there were no images in the exam which used to. Now, last 2-3 times, we are seeing that the images are more important. What is the images and what is the importance of images in the exam? I would like our Dr. Shilpina to share.
Hello.
Ma'am, could you please unmute yourself?
Hello.
Ma'am, could you please unmute?
Hello. Am I audible?
Yes, ma'am.
Sorry, Dr. Kunal, I could not hear you properly. Please, you can repeat your question.
Ma'am, I was saying that in today's times, the importance of images have increased in the exam. So, what is the importance of images in this exam, and what are the subjects important? I would like to ask. Please give a thought.
Actually, the images are definitely having a major role nowadays in the examination. And I think with each subject, faculty is trying to show images. And with the images, we can remember those points very clearly. So I think when we are revising a subject and the respected topics we are revising, so at the same time we can go with the images of that particular topic. So that will help us in remembering that particular point also. And from that image.
Hello, ma'am. Hello.
Yes. Hello.
Ma'am, please unmute all the people, ma'am. We can't hear what you are speaking.
Hello. Am I audible to all of you?
You are very much audible.
Okay.
Yes, ma'am.
Yes, ma'am, you're audible, ma'am.
Okay, so actually what I was trying to say, the importance of image in this examination, yes, it is increasing day by day because many more images are being asked in the examination. And I hope with each subject, the faculty tries to discuss images related to that particular topic at that particular point only. And with the help of images, we try to explain that particular point. So what I think that rather than revising your images in the last, whenever you are reading any subject, any topic, you can go through with the images related to that particular topic at that point only. Because I think all of you are having the related images and we all are providing you the image related PDFs. So what it will be helping you that you are not concerned with only single question related to that particular image. Actually, the image help us as an entry ticket for the examiner. It actually helps us as an entry ticket for that particular topic. So examiner can ask any question left, right, up and down related to that particular topic. So don't consider that this only single question has been asked from this particular image. So it is that you are thorough with that particular topic. So I think you have to see the images while you are reading that particular topic only, rather than seeing the images in the last. This I think is very important. Over to Dr. Kunal.
Thank you very much, ma'am. There's even a more important question which pops up here and there, that how many subjects to be taken in a day when we are revising, when the students are doing the revision. Whether it should be only one subject at a time, or there could be they could plan 2-3 subjects in a day. what should be the ideal way
बंद झालंय पूर्ण
of
तुझं पण बंद झालंय का
studying and revision. So I would like Dr. Saha sir to please shed a light over it.
Good morning, Dr. Kunal, and warm welcome to all the faculties and all my students. Yeah, the question that I have received that whether to focus on one particular subject during revision or to target multiple subjects. See, my best suggestion to you will be, see, if you try to focus only on one subject in a day, sometime what it becomes, the subject becomes monotonous a bit. So what I suggest that you can choose one major and one minor while you are doing the revision. So in that way, you will be able to retain and also you will be able to love the two topics or the subjects that you are taking. And one more thing I would like to add here is that whenever you are choosing one major and one minor, try to choose the allied subjects. By the word allied subjects, I mean, suppose if you are studying medicine, at that point of time, you try to pick up one more minor subject allied or associated with medicine. So in that way, you can also correlate the topics. So that will be one added advantage of choosing one major and one minor. In that way, you can avoid the monotonity of the exams or the preparation per se, and you can also retain better way. Now, from the motivation point of view, I will like to say you one important thing that see, anything that you wish to achieve in life, there has to be confidence in you. Once you believe before the exam, before going into the examination hall, that you can clear the exam, then definitely you will clear the exam. No matter what is your study level or what is your preparation level, but you should always go to the exam hall with the self-belief that today is the day, it has come, God has given me opportunity in all this dilemma and all this critical condition. 31st August, the exam is happening. You will go, you will enter the hall, you will write the exam, and you will clear with flying colors. That is the self-belief that you must adhere to right now. And as all the faculties previous to me has already said that revision, 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 and revision. Amit sir also always says revision is the mantra. So that is the only thing that at this 11th hour, just 1 month to go, you should not focus on new things. Sometimes the notes might become vast, or sometimes the note may feel that there are 19 subjects that we are covering in just 1 month time of preparation. But you have to understand one thing better. We are talking about the toughest undergraduate degree in the whole world. No other undergraduate degree in the world is of 6 long years of duration. ये MBBS ऐसा ही है, 5 years plus 1 year of internship. So 6 years knowledge we are asking you or requesting you to finish or revise in just 1 month time. So during this 1 month time, you have to be focused. You have to be methodical. By the word methodical, I mean, as Salman sir has already pointed out, no need to focus too much on missed all in on. As you have already finished your notes, just try to revise the notes and all other related doubts will be already covered. From the notes, I will suggest each and every faculty of MIST would have told you that this is the expected question. These are the questions that has been asked in the previous years. So try to focus more and more on the questions. Whatever in your notes is marked as Q, do not miss those. Even if you cannot finish our whole notes, just go with the at least finished your questions that we have told you. So in that way, I believe each and every one of you, those who have got less time to prepare for 31st exam, even those students can come out with 180 plus in the exams. Try to aim for little more so that even in case 10-15 goes here and there, if some difficulty level questions are coming, even you can score more than 165 or 70. So target for those students who have got only 2 to 3 months of preparation time, your target should be at least more than 180. And those students who are with us since the last exam, that means the December 2019 exam, all of you must target 200 plus. That should be your ideal goal. And as Dr. Salman has already pointed out, that rest is very, very important before the exam. I also suggest all the students, no matter how much you study, how much you wish to study, one day before the exam, please stop studying. Do not open any notes, any MCQ books, anything. Just one day before the exam. Last one day is only for your rest so that you can all recollect whatever you have studied and go with a healthy attitude in the exam and believe. Again, I'm telling you, please believe that you can clear the exam. With belief, we can do a lot of things. confidence level in passing any exam in your life. FMG is just the starting point of your career. This is just the checkpoint. Once you pass this, you will become a doctor in India. Later on, there will be so many things: PG, fellowship, super specialty, DM, NCH, and so on. But belief is the key, confidence level is the key, and do not change your answer. Sometimes I get to feedback from the students, sir, I have changed my answer, but later on I have found out that the answer became wrong. So please do not change your answer. Whenever you read a question, give sufficient time to read the question, then you look at the options, and whatever option pops up to your mind for the first time, believe me, in 90% of the cases, that is the correct answer. So don't change the option or don't change the answer by asking some other doubts to the students neighboring to you who are writing the exam. Will be there. So please mark the answers correctly and wish you all the best. And I'm pretty sure that all of you can come out with flying colors in the upcoming exam. Wish you all the best and God bless you all. Over to.
Am I audible properly, I suppose?
Yes, you can.
Okay. Now, we all, I mean, like we have discussed that how to plan a day. We have even discussed that, whether to take a single subject or multiple subjects. We've already talked about the images also. But then at this point of time, students are also very much concerned about that, sir, exam is very near. एग्जाम आने वाला है सर, समझ में नहीं आ रहा, नींद आनी बंद हो गई है, डिप्रेशन हो रहा है, एंजाइटी हो रही है. How to deal with this fear of anxiety and depression? Now for this, I think nobody else would be better than our own psychiatry faculty, Dr. Ankur Jain sir. So please, sir, could you please shed few thoughts over this, sir? How the student should fight against it?
Thanks, Dr. Kunal. Am I audible?
Yes, sir.
Okay. Hello, friends. Myself, Dr. Ankur Jain, and I would like to touch two important aspects of last 30-day revision. First is that how to avoid depression and anxiety, and second, very important, giving regular test in means is beneficial or not. First, depression comes when we think that we have forgotten everything. This is a very common question. Student ask many times that, sir, we feel that we have forgotten everything. But trust me, it is scientifically proved that we don't forget anything. It is just the material goes at subconscious level. And at this time, if you do slight revision, that will come at the surface with slight efforts. Now, question is how to be positive. We usually say, be positive, be positive. This is the theoretical part. But how to be positive practically? How to say ourselves that we are to be positive? First thing, faith in you and your mentors. Faith in you, you have worked hard. Definitely, you have worked hard. I know that you have 12 hours class and you were so much tired. Even then you were studying again, yes, after going to the home. So you have worked hard. Believe in yourself. Your mentor. Definitely, we are collected here. I am not saying because I am the part of it, but you are guided by among the best doctor all over India. So keeping in the mind, and the first milestone you achieved by choosing NEET. Yes, I have seen the background that most of the students have cleared the exam of NEET. So it's not saying because I am connected with NEET, because it is the positive thing. How we can be positive?
എനിക്കൊരു ഫോൺ വേണം, നെറ്റ് വേണം.
Without
നെറ്റ് ഒന്ന് കണക്ട് ചെയ്തോട്ടെ.
we can't be positive. Please unmute.
നെറ്റ് ഒന്ന് ഷെയർ ചെയ്തോട്ടെ.
Okay. Somebody was disturbance was there. Okay. Now, I'm not saying because I'm a part, but keeping in mind you have worked hard and correct guidance is there. You have read a lot of material, so just you are to bring this material at the surface. Now, what is the importance of regular test in the last 30 days? The outcome of test may be positive or negative, but in both that mean good marks or bad marks. But in both cases, you are to be positive. How? First thing, yes, if good marks is there, means your preparation is good. Maintain the level. No overconfidence. But If you get poor marks, take it as a stepping stone to success.
I feel there is a little bit of disconnection there, and we really welcome Praveen sir here on board. And we can see Praveen sir is in this suit. He is in the hospital fighting for the patients. So I would request Kunal sir to continue with that moderation part. And,
इसकी
Ankush,
वॉइस क्यों नहीं आ रही?
Sir, I'll do it, sir.
Yeah.
So Dr. Rees sir has also joined. Welcome, sir.
Hello, Kunal, and hello, everyone. I
Hi,
hope you
sir.
can hear me.
Yes, sir. Good afternoon, sir. Very well, sir. We can hear you, sir. How are you, sir?
I'm very good. I'm very good. And I hope all my students are pretty fine and doing in the best of their health.
Sir, they were waiting for you, sir. Thanks for
I
joining us, sir.
Yes, please.
Sir, can I straight away fire a question on you, sir?
Look, first of all, I'm sorry for being in this position. I told Dr. Vineet sir, I would be in a untypical position to speak to all of you. Sir said,
Yeah.
no, sir, it's a good idea only.
Yeah.
Hello, everyone, guys. Welcome you all to this really last 1 month preparation. The preparation, even though it's 1 month, I believe it has been your 1 year preparation, in fact, 5 years preparation. And to top on that, we had, I think, a good interaction with all of you for the last few months. And having said that, most of you are well prepared, and I'm very sure that you will do in the best of the upcoming exams. Kunal, do let me know what if any student has anything to ask me, any sort of question that you are, do let me know.
Sir, actually, sir, we basically have got certain questions which we generally get on regular basis. So
Right.
there's a very important question which the student asked that, out of these, like it's in last month. So out of these, all the 19 subjects, which subjects are more important and to be focused on in the last 30 days for the exam?
Right, Kunal. So, guys, I think because we all know that this NEET exam is always for the FMG and the next exam that we are coming into. But right now, because what we have been seeing for the last year also, the pattern has been changing a lot for you all, guys. I'm very sure that this year the pattern would be almost same. So the clinical subjects, I really feel so, is one of those that you must actually take care of. So the paper 2, guys, paper 2 is what will actually decide what marks are you getting. But to get to 150, you have to do well in paper 1. Believe me, guys, after you appear for the paper 1, a feeling comes into you. Ab to ho gaya, 150 to is done. 150 is done. So that feeling will come definitely if you appear when you are applying for paper 1. I'm very sure that you will all do very well. Now coming into those, I'll say, guys, what are the important, I should not say topics, but if you ask me, sir, what are those important subjects to take care of? To top on that, the most important I will say is surgery. Second most important I'll say is gynae ops. And you all know that the paper 2 is, filled of those things. Now after that, I think PSM again is a very huge scoring subject. All the short subjects are important. And one thing I'll just tell you, I always tell in the class that even a one question from anesthesia has 1 marks, a one question from surgery has 1 marks. It doesn't mean that you will leave a subject. Okay, don't do that. You still have 30 days. And believe me, if anesthesia has been taught, or say any sort of it has been taught to you in say 15 hours or 20 hours, revision will just take 2 to 3 hours. That is what we know, because you have been revising for so long I'm sure you can revise it again. So there's no point leaving out a subject. Number one, you should not do that. Obviously, these 3 subjects I just told you should be a revision module for every day. Okay, that means you should take out these subjects every day so that you don't leave a sight of these. In paper 1, let's come to paper 1 now. Obviously, my subject is most important because it is it's a current subject to all of them. But having seen the papers for the last 6 years that I've been actually teaching the FMG now, if you look at the first year subjects, I will say anatomy is very important, and the most of the questions from anatomy are worth doable from the notes itself.
Yeah, I'll call you back. I'm on a Zoom meeting actually right now. Please.
Sorry.
Sir, could you please unmute yourself, sir? Praveen, sir. It's got muted, sir. Can you please unmute, sir?
Okay, sorry, yeah. So I think from the first year subjects, anatomy is very important. Biochemistry is very scoring. I know it's a bit, you forget a lot, but with the multiple revision that you can do, you'll all remember that. Physiology, you know that physiology in your fingertips now. You can just shell out physiology. In second year, pharmacology, I'll tell you, has minimum of 10 to 15 questions, minimum. So make sure that the single pointer of the pharmacology, that means especially the antibodies, the new antibody that the sir has given you, the mechanism of action, those are again very, very important. The kidney chapter, ANS system, okay, autonomic nervous system, and the kidney. I believe I've seen so many questions being asked repeatedly on that. From pathology, what I can say is, I always say, and I think Kunal will agree to me, that the general pathology is very important, especially if you look at the hematology part. Then I will say acute leukemia. There is no, last 5 years I'm telling you the history, there's no question without a question on image-based question on acute leukemias. So make sure you can identify the blasts, you can identify the OR rods in them. Similarly, chronic myeloid leukemia is very, very frequently asked, especially if you take on that. Systemic pathology may, again, usually I say this with a huge confidence that kidney is one chapter that you must read daily, okay? Because it makes your basis of medicine also very strong. Now, coming to the forensic medicine, I believe that IPC, if you can just learn IPC, 3-4 questions to your fingertips mein hai, right? And you should be able to do that. Microbiology mein, again, I think that parasitology is one part which is usually not read by the students, but it's very, very scoring. In the ENT mein, Dr. Dhawan is already there, so I dare not say about that, but I am very sure that sir will tell you better way of dealing with ENT. But I know what that, ENT mein tumors, the tumors really, schwannoma mein upar, always there is a question that I've seen. The cerebropontine tumors. Polyps again is very, very important from the ENT point of view. So guys, that's it about the subjects and the topics. It is from my point of view, obviously, because faculties are there who can tell you, but I can just tell you what is, suppose I have 1 month remaining. So I have read many things. Now I need to know what to read in this last month. So I will not be selective, Number one, I will not be selective because I have read the whole thing for last 6 years. I don't want to be selective. So in those subjects per se, what I can pick out is the highest yielding topics. So remember those points when we used to stand up in a class and tell you, Dekho bachcho, this is important. So we would teach you so many things in the 10 hours, but then you would say, ye to aayega hi aayega. And you would revise those things also. That is the point that you should again bring back in your mind. Okay, faculty told us that this point is important. So these things are very, very, very high yielding. Right.
Thanks.
So, guys, if you have any doubts, do let me know. Kunal, the mic is back to you.
Thank you very much, sir, for giving us time and valuable feedback to all the students of ours.
I have a question for Dr. Praveen.
Yeah, please.
What about ophthalmology, Praveen? As you can, all the students can see the only part.
Oh my God! Oh, sir.
Visible.
I
only
dare not tell.
Only part visible of Praveen is the eyes. All hidden.
Sir.
So you can imagine the importance of the eyes.
Sir, I dare
Eyes,
not say
eyes,
about
very important, sir.
it.
I would like to say one thing before we go next, sir, that people are joining from workplaces. Ray sir, Vivek sir, Praveen sir, that is really commendable, I would say. And I think students would be appreciating it that the concern for their well-being is so high that people are joining from amidst their clinics also. That's really wonderful gesture.
Hats off to every one of them, sir, that they are taking out the precious time from this particular scene, this situation. This is what they actually feel for the students. And
Truly, sir, the one moment that you told us that if you come, sir, the students will feel that motivation. So I think that is what we are here for. We will always motivate you till the time that you know us and you keep on interacting with us. डॉक्टर रे सर हम आपके सब्जेक्ट के बारे मैं I'm too eager to tell you about that, so I dare not tell about that. But
क्वेश्चन में ब्लैक में पक्का कंफर्म कर दो.
Sir, I really think इस बार अगर कोविड के ऊपर क्वेश्चन ना आए, if there's no question on COVID, I think the paper setter has completely gone mad. So COVID के ऊपर questions आने हैं, and you don't need to expect that pathophysiological questions on COVID. You expect how to how to prevent COVID, number one. What is the importance of antigen testing in a COVID? What is the importance of antibody testing? Remember, this question also came in AIMS this year, and I really think that this question will again come. Importance of COVID antibody testing in the general scenario. Definitely, you should know this. And the treatment, because it's not very much, I'll say anything has not been ascertained, so I don't think that would be a question. But how to prevent COVID, that should be a question this time. Thank you, guys.
Thank you. Thank you.
Kunal, thank you. Let me
Thank
know.
you, sir. Thank you. Thank you very much, sir. Now, sir, following towards the end now, like we all say that we have to revise, and everyone say the same thing, that we have to revise again and again. And when we open our notes, and then we stack up those notes, so they become a 2 feet height notebooks. So we are very we become fearful. The students, they become fearful that how to do it. So I would like to ask Dr. Racer, sir, how can people scan the notes in a quick way so that it becomes more fruitful for them? The time is less, so how the revision can become more fruitful?
Okay, I hope I can audible. Good afternoon to all of you, ladies and gentlemen. Sorry for joining late as usual. Good afternoon to all of you, and for those who have just got up, good morning. The question is of memory. Now, memory is such an important part of life. You are part of memories. We don't want you to be in a situation like Karna in Mahabharata, when at the crisis of his life he wants to talk, he wants to release the Brahmastra and he's forgotten everything. But that was because he was cursed by his guru. And here you have all your gurus here blessing, so there is no question of that. So memory is important. And as Dr. Praveen was saying that you have been studying for 6 years, which I doubt we have been studying for 6 years. I don't think so that at all. What it is about memory. Most of you, my personal experience, do not exercise memory at all. Which is that most of the boys I've spoken to do not remember their ex-girlfriend's phone numbers also. And one girl I spoke to had forgotten her boyfriend's face. When I expressed surprise, she said, "Sir, all cats are grey in the dark." That shut me up. But what I want to tell you is your memories have to be utilized. And the 3 structures which help you in memory are very strange. One is a almond, like badam, amygdala. One is the prefrontal cortex. And one most important 1 month you have left. you've already done revision. The problem is that many of you are also subject to rumors around, floating around. As the exams come nearby, you will have a lot of rumors floating around. There will be people, come to you and say the paper will be leaked to you, the question will be released to you for a certain amount of money, 5 lakhs, 10 lakhs, 15 lakhs. Please do not go into that. Every year there's a scam like that. There will be, snake oil salesmen coming up with claims that we will tell you the questions we pass you. Please do not get into all these. I know at least one institute director who's in jail because of this. Okay? So please do not go into all this when they tell you that we will tell you the paper, we will tell you the quiz. It cannot be done. Questions cannot be done. That's absolutely essential. You have to rely on your own memories, on your own work. Okay, now, so in the next 1 month, what is it that you do that you form these memories? As you know, memories are formed by synapses of the 80 billion neurons in your brain. So you have to constantly revise. That's the meaning. It's called consolidation. Memory is consolidated by doing it again and again. But in this 1 month left, what do you do? So I suggest what I would have done in your case. Now, let us say that I have done 19 subjects. I want to revise. Now, 19 subjects cannot be revised in 30 days. So what you do is, some idea of which Dr. Praveen told you, is the high-yielding topics. In my opinion, since you cannot scan all your notes in 19 subjects, not possible. It's a human brain is not like that. So you make up some high-yielding topics of each topic, each subject. Okay? Let's say 15, 20 topics of ophthalmology. We will give it to you. Like, for instance, as Dr. Untitled said, retinoblasty, there is no doubt about it. Retinoblasty will have a question. Diabetic retinopathy will have a question. Neuroophthalmic disorders, visual field disorders will have a question. Trachoma will have a question. Things like that. So what we could maybe give at least each of our subjects, everybody's done, of the high-yielding topics. Suppose I give you 20 high-yielding topics. Say trachoma, say neuroophthalmic field effects. And 20 high-yielding topics in ophthalmology is not a great deal. Similarly, for each subject, we will do that. And you could scan them rapidly and do that. Now, the question is, remember that it is not at all feasible that questions will be asked from these, but it is again the higher possibility. We are talking about possibilities. We are scientists, we are not soothsayers, we are not astrologers, and we are not Nostradamus that we can predict the questions. That's not possible. But we can predict to some accuracy the area around which we are. So, like doubtless, every subject has their own listing, as ENT has, pharmacology. Pharmacology, of course, almost everything is important. Salman will be crazy trying to find out what are the high-yield topics, because everything is high-yield. But that is what I suggest, that in this last 1 month, if you have done all your revision, then please go through these high-yielding topics. Okay? Say 20 topics from ophthalmology, or similar number from ENT or whatever. Go through that, repeat it again and again and again. That is what my strategy would have been for all 19 subjects. But having said that, I find a lot of rumors floating around. What is that? One rumor I just felt that you are not to chase these shady institute owners who will come to you with claims of leaking the paper, leaking the exam. You have to first go away from that. Second is that this widespread rumor often floating around the students is that it's enough if you study 12 subjects, 10 subjects, 12 subjects. It's not enough. It's not enough. Let me tell you, if you study 10 subjects, it's not enough. If you study 12 subjects, it's not enough. Maybe 19 or 2 weeks, but at least you should aim for 15 to 17 subjects. This is my own opinion. I do not say it's one buffer. At least 15 to 16 subjects should be done well. You cannot pass with 150 with 10 subjects. So that is another myth. You must. I know that everybody wants to reduce their work. What to do? So this is what I would suggest. The high-yielding topics, and repeat it again and again. Sketch them, draw them, write them down. Just reading it, lying in bed, lying in bed like that, looking at the ceiling, taking a bowl of almonds from your table, watching a movie, talking to a girlfriend. This is not the way you study. You study in a table, chair, or a bed. Sit up, have adequate lighting, and focus. Write it down, draw it, sketch it. This is how memories end. People talk of my memory, years of memory, I don't forget to do it. This is simple, there's no trick to it. I just focus. I just focus, and that is how I'm able to remember stuff. Okay, so remember, again, we don't want you to lose your memories in the middle of the paper. You don't want, like, Alibaba and Charles store. Kasim goes inside, remembers how to go in, full jar sim sim, but cannot come out again. Cannot come out. So please remember, focus on this stuff, and best of luck to you. And all that I have to say is focus on your memory. Memory is life. So long as you have love, so long as you have memory, there can be no real loss in this world. Thank you very much.
Thank you very much, sir. Thank you for your nice words. And now I'd like to ask Dr. Vivek Sharma, sir. So, like, I know students ask us a lot of times, that whether we should sit for the tests which are being asked, taken by MIST on regular basis or not. I mean, how important those tests are, and how to, what to get from those tests for the students. Please share some light, sir. I would like to ask you to unmute yourself first.
Am I audible, Kunal?
Yeah.
Okay. So very good afternoon to all of my respected faculty and to all of my dear students. So, you know what? Today energy is little high. Why it's high? Because today we are going on a live Facebook session to motivate you and to clear all your queries and doubt about whatever the blues you were coming through from the last 5-6 months and all this time. So Dr. Kunal has asked you a very straightforward question. Are the tests of importance or not? That's what I am getting. See, as usual, I will explain you in a very systematic and through an example. Let me take the example of Milkha Singh. I hope we all know who is Milkha Singh, the living legend, the athlete, the showman of India, right? Why he is so renowned? What was special in him which is not in us? He had a goal. Goal is his first race, the race he won was for a cup of or a mug of milk. His senior told him that I will offer you a cup of milk or a mug of milk if you will run some 500 meters in a given time. He ran away. He had pain. He had cramps. He was shortness of breath, but he ran just to achieve the goal which was decided for him. So what I am saying, my dear friends, these tests, the mock test or the discussions which we have in the class, these are little targets to achieve a big goal in our life. And today we are having a goal which will bring glory to our life. So giving the mock test or having good healthy discussions in the class is always and always beneficial. Am I clear? Now, second thing, my dear friends, if an institute like MIST, prestigious institute like MIST, conducts some tests over there, then it means, my dear friend, they are setting your standards very high, very high. People who think that they are going to score 150 marks, 160 marks, my dear friend, please mind it. Everything is possible in this world. Everything is possible. We just need to set our standards high. We have to think like we are going to score 250 marks, 290 marks, or even you can think that you are going to score 310 marks, 10 extra marks. आप अपनी तरफ से लिख के आ सकते हो, मेरे को ये भी आता है, right? So giving these tests will build up your confidence, and to retain that confidence, we need to be focused. As Ray sir said, focus. Now, what is focus, my dear friend? जैसे अर्जुन ने फोकस रखा था मछली की आंख पे, वैसा ही फोकस हमें रखना है in these coming 30-40 days. Am I clear? And secondly, my dear friends, we should be revising all the subjects in a very systematic manner. Now, we can divide these subjects into parts. One is short subjects, one is long subjects or healthy subjects. We call it like medicine, gynae, surgery, whatever the subjects are. Short subjects like dermatology, orthopedics, anesthesia, psychiatry. Now, what I feel we must be doing at this time, that we take one long subject, along with this, we can take a short subject. And for short subjects, we can take a rapid revision exercises like this thing. Now, from medicine point of view, if I ask, then I would like to say this. See, in the class, even I told you, we must remember 3 P's: physio, patho, pharmacology. When you are revising a good physiology, when you are revising good pathology, when you are having good command on pharmacology, medicine isn't free. There you revise medicine, my dear friends. And keep on revising the subjects. Keep on revising the subjects, my dear friends. Keep on revising the notes which were delivered in the class. This is not the time when you have to focus upon new material. If you will do this, you will be getting misconfusing and there will be mixing of the concepts. So whatever the notes were delivered to you in the class, irrespective of whatever the faculty or which faculty, what notes, all are very brilliant notes, my dear friends. I guarantee you, if you have studied those notes very carefully and by heart, my dear friends, you can clear all India NEET examination with these notes even. The same notes. See, I was I myself tell, I am a student of Ray sir, I am a student of Vineet sir. To clear my all India examination, I followed their notes. And now I am heading an intensive care unit. Not one, not two, but I am heading 3 intensive care units in Chandigarh. Am I clear? I was in the same boat which you are now. I was attending the classes, I am telling you, back in 2008, 12 years back of now. So my dear friends, you are in a very good hands. All you need to do is stay focused. And remember one very good thing from Bruce Lee. You know who's Bruce Lee? That I am not scared of a person who knows 10,000 tricks to kick someone. I am scared of a person who knows 10 tricks and who has practiced those 10 tricks for 10,000 times. If that person will kick me, I will fall down. So giving the exam on repeated basis, I mean the class exam or the test on repeated basis will lead you to success, my dear friend. So whatever you have studied, keep on revising those things. Keep on revising for at least 10 to 12 hours a day. And this is the time where you have to decide that what are the distractions you have. You have to make a list of distractions and say no to all these distractions. Let's say it is social media. Let's say it is your phone. Let's say it is your boyfriend or girlfriend. Put a no mark on all of them. No means no. You should be very much focused upon your notes, upon your MCQ book. Spend at least 3-4 hours upon your notes and 2 hours at least upon your MCQ solving practice. Guys, everything is possible in this world. Everything is possible in this world. Please do remember, as in the class, I have already said that there is a law of attraction. You feel that you are scoring 250 marks, you are scoring 270 marks. And trust me, my dear friends, your thoughts will turn into action and action will turn into results. I think Amit Gupta sir has started a very new initiative of meditation and motivating upon Facebook. You must be following that. Trust me, my dear friends, this is the way you can achieve success in your life. Stay focused, don't be distracted, right? And whatever the notes you have, keep on revising them. Try to spend 3-4 hours upon your notes and at least 2 hours upon solving the MCQs. Am I clear? So thank you, Kunal, very much. And any queries, anyone wants to ask me anything from medicine point of view, they can ask me, please.
Thank you, Vivek sir. Thank you very much. We all, say the same thing to the students that, tests are very important because they are the thing which tells us basically where we are in the time of our preparation, basically. So, exactly, but then, afterwards, when the students give tests, then the next day morning, they get the result on their WhatsApp groups. And then they, there are some people who have studied very well, but somehow, they are not able to score good, or for them, the paper was a little tough and somebody has scored more marks. So they get, a little bit of anxious and depressed in that way. So I would like to ask Dr. Shilpi ma'am, ma'am, could you please enlighten the students about the results, how to deal with the bad result if they're getting a bad result in the weekly test or the mock test?
Okay, hello to all the students. I hope I am audible. Am I audible properly?
Yes, sir. Yes, ma'am. Yes.
So hello to all the students. So when we are talking about this test, you said that we are giving the test and somehow the result, it does not come to be good. Now, first thing you have to keep in your mind is that these tests which we are giving, these are for analyzing what we are doing, what we are preparing. These are not the final assessment. Your final day is the day of exam. So take these exams as motivation. And the one thing you have to do is the purpose of a test. The purpose of the test, you have to identify the purpose of the test, analyze the test. After giving the test, after seeing the result, you have to analyze it in 3 points. Now, how will you analyze it? First thing, you will just see all the questions and whatever you have answered, you will see that where you are going wrong. You have to identify your mistakes and you have to correct it. So identify where you are going wrong and you have to correct it. You have to first thing see, are you missing any important topic? Because as we know, important topic is always important. So whatever we have studied till now, you already know that what is important, has been previously asked. So what is important, it will always remain important. So first thing you have to see that, is there any question which is from the important topic and it is going wrong? Second thing you have to see is, like when you are giving the exam, you are revising. Of course, you are revising. So you have to see, is there any question that you have revised, but somehow you have by mistake done it incorrect? So that is the second thing you have to identify, that is there any defect in the revision process? Third thing which you have to identify is that any new important points which you are gaining from that test. So basically, in the end of the test, you are analyzing yourself that is there any topic which you are not studying properly, any important topic which you are missing. Second thing, you are seeing that if I am revising properly or not. And third thing, you are seeing that you are learning few important points, more important points, because every test is having 2 or 3 new points to learn. And after that, you plan your strategy. You think about that if the revision is not going properly, you have to take a right direction. At that point, just decide that you have to take a right direction. You have to revise what you are having in your hands, like what the notes you are having in your hands. That is the main thing. No new things. Whatever you are having the notes, you have to revise it again and again. The questions which are important, the questions which are again and again asked, and the questions which have been told to you by the faculty that these are the expected questions or these are the important questions, such points should never go wrong. So you have to focus yourself on those points, and that thing you have to keep in your mind while you are giving the test. Secondly, when we are giving the test, please don't get demotivated by if you are getting less marks than your another friend who is sitting next to you. Don't get demotivated. There is no scope for any demotivation at this point of time. This is the most crucial time for your exams. These 30 days, these are the most crucial time. Just keep away any kind of negative thoughts, any factor which demotivates, keep it away from yourself. Just use anything, whatever you're having, that test or the other notes, they should motivate you, and you should have the belief in yourself that yes, I can do it. So that is regarding the test. The thing is that you have to analyze it basically, and you have to use it in a positive way. And take my words that you will be able to do it. Just record this thing in your mind. Yes, I will be able to do it, and I will utilize each point of my time for the success I will get on the final day. So over to Dr. Kunal.
Thank you very much, ma'am. Thank you very much. Now, I would like Dr. Amit Gupta, sir. Sir, please, sir. Like we are talking from last 40-45 minutes, and there's a general consensus that yes, a revision is very important, and we have even known the subjects, how we have to bifurcate the subjects in the revision protocol. But then I would like to, you to shed the light how to basically revise. What is it? How to revise?
Thank you, Kunal.
Yes, sir.
Hello, loving students. How are you all? मेरे प्यारे बच्चों, कैसे हो? A lot has been said for last 40 to 50 minutes. All esteemed faculties have shared their views, and it has clearly been discussed what subjects have to be revised, how they should be revised. But the only problem which I feel at this juncture, right 30 days before examination is, we know it has just been discussed in last 40 to 40 minutes that what should be read, what should be revised, which subjects are more important, we will definitely be choosing high yield topics, particularly in the last 30 days. The thing is, I will start with what time you should wake up. Your exam is from 9 to 11:30 a.m. and 2 to 4:30 p.m. What time do you wake up? What time you want to wake up, my loving students? My sincere advice would be, adjust your clock according to examination day. So on examination day, what time will you wake up? You have to travel a distance. You have to reach your examination center. You have to be there at 7:30 a.m. So start waking up at around 5 a.m. or 6 a.m. And if you want to wake up at 5 a.m. or 6 a.m., definitely you should go to sleep by 12 a.m. or latest by 1 a.m. in the night. So adjust your clock according to examination day. Another thing I would like to share, as our faculties have said that we get distracted very soon, maybe by Facebook, maybe by WhatsApp, maybe by other social media as well. We get distracted soon. Improve your self-esteem, and at this point where you are confined to your room, we are all in isolation in the lockdown status, although it is an unlocked scene now, but still we have some limitations. To improve your self-esteem, I would suggest you only one thing. Everyone has some biscuits at the home, some pieces of bread at the home. Even if you are not having some biscuits or bread at home, you are definitely having a wheat flour. Put it outside your home. It will take you 30 seconds, my loving student. Put it outside. You are contributing something to this universe. Just one piece of bread, just one piece of biscuit, or just little amount of wheat flour. You are contributing to the universe. Universe is looking at you, and universe will definitely reward looking at your attitude. So waking up at 5 or 6 a.m., then putting something outside, and it would be highly appreciable if you are putting a bowl filled with water outside your home for birds also. Then have a shower, then start studying. Once you start studying, what has to be done? It's not like this, we are lying on our double bed or single bed or on a sofa like this. Because of this online situation nowadays, properly sit down on your study table, particularly between 9 a.m. to 11:30 a.m. and 2 p.m. to 4:30 p.m. You should sit down on a study table, wear proper clothes, and I would recommend even to wear shoes also, so that you are acclimatizing yourself to 31st August. Otherwise, what will happen? You will feel sleepy. Students try to take modafinil and just not to sleep. If you are studying whole night, what will be happening on 31st August? You will definitely feel sleepy in paper 1 and paper 2 both. So adjust your clock according to that. As I told you, you are putting some piece of biscuit or bread. This little change in your thought, is going to produce marvelous alterations, miraculous alterations in your end result. And when you are sitting on your study table, we know how to get rid of distraction. I love listening music just for 1 minute. I know it is just 30 days before examination, my loving student. Listen to music. I get utmost concentration whenever I'm starting some work. I listen to a music just for 1 month. Just for 1 minute. What is happening listening to this music for 1 minute? You are well aware of EEG and sleep topic, my loving student. Alpha waves. This music will take you to this alpha state, which is also called as trance state. Because at this time, when we are doing revision, we are on our study table, we are revising, and it's not like this, we are reading, it is rapid multiple reading. Rapid multiple reading. It's not like this, we are taking 5 minutes to complete 1 page. 30 seconds for 1 page, my loving student, just 30 seconds for 1 page. Rapid multiple reading, rapid multiple reading, rapid multiple reading. You are solving some Q bank. You are stuck. You have marked the answer wrong. If you have marked the answer wrong, Immediately go back to your notes. Immediately go back to your notes. Open up your notes. Why did you mark this answer wrong? What has gone wrong? And how much time do you want to waste to look at that page? 20 seconds, 15 seconds. Time is in seconds, my loving students. It's not in minutes. So when we started our studies, when we were listening our classes, I kept on saying speed of recall from examination hall is directly proportional to how attentive you are while listening the class and how attentive you are while revising. We have all discussed in our classes that we will definitely be underlining with highlighters and all. This is the time to choose the keywords. Everyone has chosen their individual keywords. What are your keywords? Where were you stuck? What are the most high yielding area, most high yielding topics, most high yielding subject? You know all this very well. But the only thing is how to bring ourselves on track to utilize maximally these 30 days. We have to utilize these 30 days maximally. No distraction. Study on study table. Proper attire. We will not feel sleepy on examination day. Try to have similar meals, similar breakfast, similar lunch as we will be having on 31st August. Many of you would be migrating to some other town, to some other place for examination. So keep in mind some isolation day. Keep in mind some quarantine day, which will depend on the situation on 29th August and 30th August. What we have to do, we have to maximally concentrate on our study, because one student can get an output of 16 hours study just by studying for 4 or 5 hours. How this miracle happens? Studying for 4 and 5 hours and getting output of 15 to 16 hours. Concentration, my loving students, concentration. What I personally feel with my last 20 years experience in clinical practice and in academics, this music helps me a lot. I listen to this music just for 1 minute and I go in this alpha state or trance state, and I get the output of 16 hours in 4 to 6 hours only. So my sincere advice would be just focus on all these things to optimize your concentration. Over to you, Dr. Kunal. Thank you very much. Good luck, guys.
Thank you, Amit sir. Thank you very much. Now, I would like, the exam is on 31st of August, and let's imagine a situation that, the students are doing all the things in the month of August and all the mock tests are done. And finally, around 5-6 days before the exam, what should be the strategy for it? And I would like Dr. Rajiv Dhawan sir to speak on it, please, sir.
Thank you, Kunal. Thank you very much, everyone. Good afternoon. Guys, first of all, I would tell you one thing, that please start believing that you're going to clear this exam. From now onward, every day you should tell yourself you're going to make it happen, bache. Okay? And let me tell you why it is possible. If you still have doubts about it, that oh no, sir can really say all these things on his behalf, but for me it is not applicable. Let me tell you how it is possible for all of us to make it happen. Everybody look at the screen. Allow me to share the screen, please, guys. Okay. Now, please look at this algorithm. Guys, if I do not know 75 questions, I am a topper. If I do not know 75 questions out of 300, I am a topper. Don't you think so? You should tell yourself that I will certainly pass the exam. Beta. Read the second line. Even if I do not know 100 questions, I'm a top scorer. I repeat, if I do not know 75 questions, I'm one of the toppers, first 10 people in the whole country. If I don't know 100 questions, every third question I do not know, bloody I don't know that much even, still I'm a top scorer, beta. I'm scoring 200. If I do not know 150 question even out of this paper, still I'll pass the exam, beta. Still I'll pass the exam. Please do remember this thing. Take a screenshot and save it as your screensaver on the phone and look at this slide every day. because this is a reality, beta. Reality is this actually, that even if we do not know 75 questions, we become a topper. We don't know 1/3 of the paper, we become the top scorer. And we do not know 150 questions. Bloody every second question we do not know, still we pass the exam, beta. Then what I would want to say, beta, that we will clear this exam. We will, first of all, everyone should instill this within your all chromosomes that we will make it happen. Is this a hypothetical discussion I'm doing? You ask yourself. Am I trying to stupidly motivate you? No, I'm trying to be as factual as possible. You ask yourself, you dissect this algorithm on your own and spend 5 minutes. And if your one gene within you is really doubting your performance in the exam, please give this rational explanation to yourself with this kind of, mathematical explanation. So today we will start these 31 days left with this confidence, not hope, this confidence instilled within us that we will make it happen. It is doable. We have been doing it for last many months actually. I'm damn sure about it that you have a feeling of imperfect preparation right now. Howsoever you may studied, you are still feeling incomplete in many subjects. Who the hell on the planet can remember all the side effects of all the drugs? Tell me. First, Salman is sitting there. He can remember everything. Okay, fine. But who is over there? I'll say who can remember all the side effects of all the possible drugs? Nobody can, yaar. Okay, I can remember which drug is more toxic because I'm ENT. Fine. You guys are still doing very good, beta. Very good. You are trying to really memorize as much as possible. Believe me, that is sufficient too. Only thing we need to do now is the revision. Revision would really change the whole game. It's a marathon you have been running for last many months. And in the marathon, the last leg of the race is the most important part. And now we are entering the last leg of the race. Please shed away two things right now. Number one, guilt of not being your best in last few months. If you are still having this guilt, oh, I wish I could do really more, please shed away that. We are not perfect people, at least I am not. I'm very happy being imperfect. I always say I'm proud to be imperfect. But right now, your own life is demanding from you a very different kind of outlook. And this outlook is not pseudo-confidence, beta. It's a very calculated affair over here. Okay? So from today onwards, it's not a hope I will pass. I'm confident I will pass. Number one. Second, if you have this fear within you always, every day you are allowed to feel negative 2 times, beta. Every day you are allowed to feel negative 2 times. It's absolutely human. It is impractical to really feel this way that I cannot feel. I also feel negative. If I don't get my pranta in a proper way, I feel negative about it even, sometimes. So it happens, being negative is a part of existence. You cannot run away from that. But we will curtail that thought at that moment only because we are going to make it happen, beta, because we know this game we are very close to. And let me share, beta, in last 5 days, 25th August is the cutoff of your revision. You do whatever you want to. In last 5 days, you're going to do something very special. It is from my own experience. I'm telling you, it sounds stupid actually, but this works very well. This worked very well with me for also my preparation days for PG. Now, allow me to share the screen, please. Okay. Now, for example, this is your paper, beta. You are reading ophthalmology, you are reading retinopathy or prematurity, or you are reading maybe Mcqs diverticulum. Somewhere you found, oh, Mcqs diverticulum is actually having something very important. Like what? That it is actually seen in 2% of people. It lies 2 meters or 2 feet away from the ileocecal junction. Okay, in 2% of people it is symptomatic. Okay, wow. It means that this is the information is going to be asked in the exam. Dr. Vineet told in the class also. It means for me, this becomes my highlighted area of the notes. Till 25th August, till 25th August, whichever part of the notes make you feel scared that this is important and I am going to forget it. Let's mark that with a special highlighter. Maybe a magenta color. I always say magenta island because I only had magenta pen on that day. I started marking my copy in such a way that, okay, this is important, but I'll forget it. I want to see this 2 more times between 26th August to 30th August. In 26, 27, 28, 29, 30th, world may be doing anything. Anybody may be conducting any mock test. I will do that. But very honestly, I'm going to read all my Magenta Islands 2 more times. You know why? These Magenta Islands are what? They are point of importance, but they are very easily forgettable. We just forget them, beta. It is impossible. Who can remember? What will happen? Your copy, in one page, you will have one Magenta Island, maybe. Next page, no Magenta Island. Third, fourth page, 2 more Magenta Island over there. This way we'll color our copy, and what it will become, let me show you, beta. Look at the screen, everyone. This will be your kind of like Magenta Island. Okay. You know, Charcot's triad celiac cholangitis. It has got fever, jaundice, abdominal pain. Out of whole 3 pages, this is something is important. I should not forget, is it jaundice or it is something else? No, it is Charcot triad. Okay. I know. Okay. If CO2 is high, it's respiratory acidosis. If HCO3 is high, it's metabolic alkalosis. The keyword, important word can be forgotten. I am going to reserve it for 26, 27, 28, 29, 30th August only now. Okay. You know, physiology people, the pharma told us aldosterone acts on distal coronary tubule, ADH acts on the collecting tubule like that. Okay. So such kind of Magenta Islands would be there beta in your notes, and you just mark them very selectively. Don't mark your whole copy Magenta beta. That's not the purpose here. Only selectively important information, forgettable information will mark it. But you know what will happen? On 30th August morning, we'll start feeling confident. Oh, whatever was important, at least I've seen that beta. Nobody is perfect. Nobody has complete knowledge. We are bound to be imperfect, but this is the beauty of the creation beta. It's absolutely fine. You know what? If we go this way and we revise all these Magenta Islands, in the last 2 days, we'll be beaming with energy. We'll be with confidence, you know what? And, you know, the magic will start happening there only, beta. Nobody should forget these 3 mathematical calculations that every day take a screenshot and make it your screensaver, beta. That even if I do not know 1/3 of paper, I'll become the top scorer, beta. You don't have any constitutional responsibility to know everything about everything. India doesn't demand that, beta. We want you to pass, and we will pass, beta. Absolutely will pass. Everyone, you just have this hope, beta. We will pass. We have the confidence now. From hope to confidence. Okay, beta? It's our wish, utmost wish. We'll all pass this exam. May everyone pass. That this is what we are really hoping for. Each one of us is here only because of this reason only, beta. That we'll make it happen together. Thank you very much, Kunal. Thank you.
Thank you. Thank you very much, sir. Thank you for such a motivation. Even I'm feeling motivated, sir. You know, this 75 question, you don't know, you become a topper. I mean, I have thought about it. I also say in the class to the students that, beta, agar do mein se ek question aayega, then also you'll pass. So I also say it, but this way, I mean, I also feeling very much motivated. Thank you for this this thing for the students. Now, I mean, majority wise, we have covered all the things. I would give the mic to Dr. Vineet sir, and I would like him to share his thoughts and motivate the students.
It's really a proud privilege for all of us to be a part of this such an August gathering with so much of emphasis on how we all can be together and we can create these wonders on 31st of August. Before I just summarize all the views, I would like to request Dr. Kunal sir to share his own views as well.
Sir, sabne bola, sir. I think, I mean, revision is the key, as everyone is saying, and I also say the same thing. Revision is the key. And regarding the paper, I've told many times, and I mean, I have a thought that paper 2, the paper is becoming more clinical, but this time, I personally, this is my own thing, that paper 1 will have more single liners this time, and students should focus a little bit more on the single liners, because they know the answer, then it would be obviously the right answer only. So wo ghumenge nahi uske andar. So I mean, and Obs Gynae, PSM and surgery, nobody is going to leave, I suppose, whoever is serious about the MCI. And I mean, one thing which, as you have asked me, so I would want to share that, you know, many students send me messages sharing my results, their results on the regular tests which we are taking. And they become a little demotivated that, sir, last time you said you study like this, and, you know, I've got just 50% or 60% like that, and my topper is at 98% or 95% in the exam. Now, for all those students who are listening to me right now and having this problem, for you, beta, I just want to say one thing: you not think about it, because this is not a merit-based exam. This is just a screening exam. You have to get 50%, that's it, nothing else. So in the exams which you are giving with us, you just have to focus that you are getting more than 60-65% marks. If you are above 70% mark, it doesn't matter, beta. Eventually what you're going to do, once you get the result on 20th of September and there is written PASS, believe me, in the result, you know, your name would be there, your father's name would be there, and there would be your marks, and then there would be written PASS. Believe me, you're going to see PASS first, and then you'll go to the marks. Then, you know, once you think that you are passed, then other things come in mind. How much did I get? And, you know, what my friends have got and all those things. So what your friends have got is a secondary thing. What you have got is important. So you just have to focus that I have studied. I am giving a screening exam. I have to get more than 50% of marks. This test which I have given, if I am getting more than 65-70% marks in the missed test, then it is sufficient, more than sufficient. You are getting 70% marks here. Believe me, you will get more marks in your exam. So do not get distracted with the results which you are having. Just keep on focusing what all the esteemed faculties have said. Revision is the key. And I always say, and I really mean it from the bottom of my heart, that, you know, we are going to be staying with you till the very end. And we will try our level best to, you know, revise with you, give you whatever we can from our side to make you pass in this exam. The exam has been shifted for 2 months. You know, earlier when we met, I said that, you know, you have 2 more months to prepare. Now this time I want to say that we all, you know, we salute you to, you know, that you are fighting. I understand how much anxiety it becomes inside us, that, you know, the exam is postponed for 2 months, 60 days more we have to stay in this state. But how gracefully and how confidently and how positively you are tackling with all those situations, still giving all the tests and trying to study again and again and again. I mean, it shows the dedication you have, and people who are dedicated, believe me, they win. So I have no doubts. You also should have no doubts in yourself that you are going to pass this exam when the result is going to come on 20th of September. Thank you very much, and God bless you all.
One thing I would like to add, Kunal, just one thing.
Yes. Yeah.
My loving students, have faith in your faculty, because the content you got in your notes has been especially designed, updated for this 31st August examination. Just stick to your notes, keep on revising, and multiple rapid readings. That's all has to be done. One more thing, as Praveen sir just said, that this paper will not be completed without any question on COVID. I would like to add, Praveen sir, there would be at least 7 to 8 questions on COVID this year. So we will definitely be conducting a separate session on COVID. We are really waiting for any other latest update to come, and we will have this session on COVID separate. Thank you.
Thank you very much, everyone. And I would just like to summarize the story, that what should be the action plan in the next 1 month. So I would be starting right from Rajat sir, then going to Salman sir, and then going to all the faculties. So basically in this 30 days, you have to have 2 revisions. And in these 2 revisions, basically you have to take 2 subjects at least on a day, wherein 1 major and 1 minor subject, plus you have to keep on practice solving the MCQs on a regular basis, on a daily basis. So you have 2 hours for solving the MCQs on a daily basis. Within the first 20 days, you should be through with 1 complete revision, and the next 10 days you can keep for another revision. And what Dhawan sir has rightly pointed out, that from 25th of August onwards, you will be focusing mainly on the Magenta Islands thing. So the total summary is, this is how you are going to divide your revision protocol. The next thing, all the notes, they are your everything. Bible, Gita, Quran, Guru Granth Sahib. You have to just keep on following your notes with complete dedication. You have to keep on practice solving the MCQs in the tests which have been conducted for you on a regular basis. You can just go on with the revision of those things. No new content should be handled at this point of time. No new content should be handled at this point of time. whatever you have, that is more than what you want to achieve. You have to just assimilate that and come out with flying colors. The last and the thing is, always remember why you are doing all this, what you have done in the last 6 years. You have to bring that to a culmination now. And why you have to bring that to a culmination? That your parents have been doing a lot of sacrifices. You have to repay those sacrifices, though you will not be able to repay at any price, but still, just to bring happiness, tears in their eyes, you have to give them this wonderful result. The mantra of achieving this result has already been communicated nicely, forcibly to you all. And we, the entire team of MIST, firmly believe that you have really gone through a nice, wonderful approach. That first you have had gone through your classes. Every week you have been doing your test. So you are preparing yourself, you're equipping yourself nicely. And then you have had your test and discussions as well. So you have really devoted a lot of time. You have dedicated yourself. You have already done all those hard works to reach onto this stage where you are today. In the next 30 days, don't slip down at any point of time. Just keep yourself pumped up. Just keep yourself motivated. And यूं ही किसी की जय जयकार नहीं होती, हिम्मत करने वालों की कभी हार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती. Just keep on trying, keep on trying, keep on trying, keep on pumping yourself. Keep. Now it is only 30 days and I'm going to show it that I'm going to do it. I will do it. I will do it. And I am going to pass. Nobody on this earth will have the power to stop me. Just have that courage, just have that motivation inside you, and believe us that, as everyone has said, you all are going to pass. God bless you all. Wish you all the very best.